before I get started, she said, Maggie said, I'm an entrepreneur serial. So my first company was a clean tech company. So we did control and power electronics for solid state lighting. We still touched healthcare because a lot of the lighting projects we worked on were for operating rooms and things like that. But I was more so focused on clean tech. And because of the long sales cycle with a concept like that, I actually sold that company and bought a retail manufacturing business for women's lingerie products. So completely a step away. I'm sorry guys, but being in a room of 30 male engineers 24/7, I wanted something fun and frivolous, and so that's what I did. I sold that company a few years ago, and overall, I just have a real passion for health. I'm super concerned about the state of health across the world through diabetes, and I have a daughter that's 10, and I'm really trying to figure out, what is the problem here? Why are we not taking care of our health? Do we really need to be incentivized to do basic things like, brush your teeth and do your exercises and go for a walk? So I was introduced to eTrove by a friend, and after a few months of talking with them, they invited me on to become the CEO. It started off as a loyalty platform, so a mobile loyalty platform, but I'll kind of talk to you about what we're trying to do and how the technology is really evolved. So the topic is closing the loop in digital health, and I kind of outlined a few areas that I really wanted to talk about. The first is, who are the real stakeholders? I'm still trying to figure out all of the influences in digital health, and we'll get to what some of that looks like. What real problems is it trying to solve? Are they big problems, small problems? Who's identifying the problems? What does current adoption really look like? So you're going to see there's a lot of money being invested in digital health, but the adoption rates aren't as high as I think a lot of people are claiming it to be. And of course, what can we do in this room and beyond to close the loop technically? But before we get started, how many of you have a mobile app that helps you with your healthcare on your phone? How many use it every week? Every month? Okay, perfect. So that's really what drives me, but I wanted just to outline, it's big business. Last year, $4.2 billion was invested in a variety of solutions. A lot of it in the back end, a lot of it more on the patient side. It breaks it down here, genomics and sequencing, analytics and big data. I'm sorry the font's so small, that's usually not like me, but I was in my first Airbnb in a hotel kind of fixing it, and I didn't have my big screen in front of me. And then we get into telemedicine, digital medical devices, and then overall population health management. And if we just look at some of the landscape in terms of what venture companies are looking at, there's just so many companies. I'm confused. I own a software company that's trying to provide a solution for a lot of the practitioners, and I'm thinking, where do I fit in here? So there's a lot going on. It's a complicated space, and I think if we were to take a step back, which I think because of my history not being embedded in health so long, I kind of take a real third-party perspective on what I think could be some tools for looking at digital health. So who are the stakeholders? Traditionally, I talk about incumbent providers, so that would be product suppliers like the Samsungs and the Philipses. I'm sure a lot of you have those kind of tools and equipment in your practices. There's also kind of the laggard technology providers like the practice management software companies that are not a cloud-based solution, but are, they've been around for 10, 20, 30 years. And they feel threatened by a lot of the things happening in digital health. So they're a stakeholder. Another one is obviously the insurers. And I think they have a conflict because they want to, they have pressure from the patients to spend more money on them to be better. They have a pressure to keep their costs down. And they have a pressure to be integrated and do everything, but without really a lot of resources, and often not even knowing what's working and what's not. I think when we look at what Canada and the US are doing at a federal level, I'm hearing that what the insurers are looking for is how do we manage preventive health. So I think they're a big stakeholder, and we want to consider them as well. Then of course there's government. So same thing in Canada. We're really lucky in BC. You have your basic medical coverage. But in other nations like the States, it's a lot of, they're trying some things now. It's a quasi-public system, and there's still independent providers, and it's messy, and it's expensive, and some people aren't getting any help. But here in Canada, the government plays a big role because they bear, I think, 30+% of all of our budget goes to healthcare for our population. But where I get really excited is who I think the most important stakeholders are the doctors and practices. And remember, this is coming from a real digital health perspective. I think that the technologies that are out there, we need to really look at what the doctors and the practitioners are telling us they need and what they're willing to do to adopt these technologies. The patients, I mean, obviously patients have more of a voice than ever. They have access to WebMD, which, I mean, I'm prolific on. If I get like an itch, I'm sure I have some crazy disease like Lyme disease. But you know, the patients are out there and they're getting all this information and they're inundated. And I actually think they often refer back to the practitioner and say, you know, what's really happening here? So practitioners are one of the most trusted resources, and they're really, you know, driving a lot of what I think is going to be adopted with digital health. And then of course you have people like me who are super passionate. We want to come at it from a different perspective. We're coming at simplification. We're coming at new ideas, mobility, taking away a lot of the expensive back-end incumbent stuff, and making, you know, with even a mole or a mobile app that can tell you where you have a major injury. So there's a lot of stakeholders. There's the traditional, and then where I think we're going, which is the influential, and of course the innovative. What problems is it trying to solve? So overall system inefficiencies, I don't think I need to tell you much more about that. Records management, increased patient demand. We'd think that even just with the last 5 years of digital health, some things would be getting better. It's not. There still seems to be a lack of uptake in what some of the solutions are to help drive improvements there. And of course, patient engagement. What I also think is a really interesting perspective is this whole thing around accountability. I actually think the population itself is saying, look, why is that population not taking care of themselves? Like, I'm sitting here, I'm going to the gym every day, I'm eating healthy, my healthcare costs are super high, but yet, you know, buddy across the street isn't stepping up and going for a little walk once in a while or taking the stairs. And so I think that's actually going to be more of an overt opinion soon, because we have all this digital health technologies. There's really going to be no excuse for all of us to be like, you know, primetime people, fit, healthy, active, and have all the tools to be really good at it. And then of course the preventive health piece, which is where basically if we take care of ourselves, we can reduce costs and live longer. Overall, it's 100% of an unsustainable model. Our taxes and the pressures from the population are telling us that. Then I was trying to figure out, okay, you know, there's so many cool technologies out there, but what is the real stage of adoption? And I kind of dug around, and from a demographics perspective, the reality is seniors, obviously, they're a bit laggards in technology, and that's where I really think the practitioners take a big role in helping seniors use technology to manage their medicine and everything else. But another big variable is income. I mean, a lot of us sitting in the room are here at a beautiful venue, but there is a huge percent of the population that just don't have access to the technology, even a smartphone and data that's going to allow them to access all of these tools and resources. So I think there's a lot of consideration that we need to get into there. From a technology perspective, wearables and telemedicine are doing quite well. They're at 20 to 25%, so I thought that was a good number, but it's not 100. And practitioners. So this one's really interesting for me because what we do is integrate with the practice management software. But what I hear, we deal with dental, physio, ortho, optometry. Really, 5 to 10% are taking on some of the new cloud-based practice management software. Why? Because it's expensive. And they have great people at the front desk that have to be retrained. They have other pressures to maximize revenue and efficiencies. And from what I also hear is that a lot of these practitioners don't really have a business expertise. They just want to be there to help the patient be the best service provider they can be. So, you know, when you have this expense, there's going to be an automatic barrier to entry for some of these great technologies that are being developed. And then investments. Investment plays a really big role in how technology companies can actually get in and market to everyone and educate you and show you how to use these technologies. So some of it's great, you know, $4.5 billion invested, but where has that money really gone? What types of companies? And who's deciding that? With my first company, you know, I raised about $10 million in funding, and I remember, like, you're sitting in this room and the board's there, and because they're writing the checks, you think you have to do what they tell you, and then they kind of steer you in the wrong direction. They're picking companies based on factors that I don't know if they're really experts in. So I'm sure there's some great VCs, and if you're here, I'd love to talk to you later, but the reality is it's just a complicated space, and I'm trying to figure out who's investing in what and why are they making those investment choices, aside from getting a 10-time return on your investment. So in the end, I still think patients are going to be the ones who drive adoption. Then I started to look at some resources and what they outline as essential factors to drive adoption and close the loop with digital health. And it was complicated. And a lot of me, that it all looks the same. So again, I haven't lived in this space for 10, 20 years. So when I hear, I get wireless devices and sensing and health IT and obviously internet, I get it. But it seems like a lot. It seems really complicated. So if I was a practitioner or a patient, even some of the people that are on the day-to-day ground at the hospitals, you can't really throw up the slide and say, oh, you need one of each of these. It's complicated. And so I'm not going to claim to be an expert on this. I'm just going to say a lot of people think you need to have one of everything. And I'd like to say you really only need 5 things for digital health to be truly effective. And let's work together to figure out what those 5 things are. A couple of the ones that are bolded are the ones where I like because my company's in that space, but we'll get to that after. So let's work on streamlining, defining, and really coming together to figure out digital health. There we go. Just some quotes. So I talked a little bit about why I think practitioners are the true influencers in the adoption of digital health, and it's just because from these quotes here, people are looking to take data back to their physicians so that they can get regular feedback on how they continue to improve and make adjustments along the way. Some recommendations, design for patients, I've covered a lot. Connect with practitioners. So if you are a software company, this is definitely more targeted towards you. A lot on the UX space as well. A user experience is really important. It has to be easy, it has to make sense. You don't all, when you first got your iPhone or Samsung's a bit more complicated. But if you have an iPhone, they were experts in user experience. You pick it up, you turn it on, and it basically figured out who you were in like 5 minutes. So, you have to kind of have that same level of ease for adoption with digital health. So design for patients, super important. Connect with practitioners to get their feedback on what they're willing to adopt sooner versus later. Provide a holistic approach. Earn trust with results. So I think a lot of companies say they're going to do something, but what are the results? So if you're a practitioner, I'd be asking that. If you're a hospital, I'd be asking some of those questions. And of course, for the patient, they're going to need to see results in order to be ready to retain on the platform. Be open for collaboration. So I'm going out talking to VCs and practitioners, and someone will say, oh, I saw something like that. Okay, who? What does it look like? Let me go work with them. And a lot of people, they think they want to be the one that's named after that one solution. And I just really think a collaborative approach is the way we need to go and think big picture. And before I move on to introducing you to eTrove, I just want to remind everybody that it really is technology that's kind of put us in this place. You really don't have to move to take care of yourself anymore. The car, you're not walking to and from work anymore. Ubers, the same thing. Driverless vehicles. Technology was developed to make our lives easier, and now we're investing billions of dollars into technology to try to figure out how to get us active again. So I find that super interesting. And if you're interested in raising money, this is a lot of the investor priorities and digital trends for 2017. So if you want to share that after, please feel free. But everything's there, and we'll be health news. So a lot of this is resource-based if you want access to the resources. I'm going to close by introducing you to eTrove, and our whole platform is about effortlessly connecting practices to their patients. And what we do is we give you a practice-branded mobile app that allows you to engage patients with loyalty programs, communications, appointment bookings, activity reminders, basically payment, everything. Anything you need to do to manage your practice, but it's fully integrated with the practice management software, which can then feed back into all the electronic health records for all of us. Some additional features that we have. So one of the things I found is when I'm out talking to people, there's a lot of practice management companies out there, and because that's our main point of integration, that's really interesting, but they're an expense to practices. We have a very proven ROI of about 500 to 2,500% on retention, increased visits, patient referrals, and some other programs that we run. So we do patient information, check-ins, newsletters, blogs, everything a patient would expect in your branded mobile app. We also have a full referral network, so if you get a referral, you give points for that behavior, and then we help close the loop to get that new patient on board. Loyalty. And loyalty is where we've actually not only do loyalty, we've transitioned into preventive health. So our campaigns are like a Good Brusher campaign, a Do Your Exercises at Home campaign. So you can reward points to your patients for actually doing their activities. And then when they come back for their next appointment, you can say, hey, great job. Then you can do a survey and say, hey, that person did that, brushed their teeth that many times this month or day, twice a day, once a day, whatever the metrics are. And they are actually showing a 5 or 10 or 25% improvement over those that are not taking care of themselves. So that's where we've actually evolved the platform to be more of that proof of preventive health and all the work that a lot of you do. And then tomorrow we're getting into payments, content management, chat assistance, basically everything you need to be engaged with your practitioners right on your phone, but where it's less work for the front desk of the practice. So that's it for me. I'm hoping that you can, I'm open for questions and feedback, and I just hope together we can look at all the things that are out there and figure out how we're really going to close the loop on digital health. Thank you.
Any questions?
Thank you, Janet. Great points, by the way. I think what's holding up the adoption is the hospital administration side. They need to have some kind of incentive in place to try all these startups, like give them a chance, like mad money of some sort, you know. I think that's what's holding up. That's my opinion.
No, it's great. I sit on the police board in Port Moody, which is a funny story. Like, how did I get on there? But anyways, you know, we see there's a lot of mental health issues. And so they'll go into the hospitals with these patients. I almost said criminals, and often they're not because it's mental health, but they have to wait hours and hours. So I'm working with the police board and Fraser Health and a few others to figure out how do we take that wait time from, 5 hours to 20 minutes. And a lot of it's technology based, saying, look, we're coming, can you have a doctor ready? And just increasing the service. So, but great point.
Now, even to buy the technology, it takes like 1 year for the hospital to even start the RFP process.
Yeah.
We're there in the middle.
Yeah.
There's a question back here.
Okay.
Hi. I'm just wondering, do you have any plan to go outside of Canada and the USA? Maybe some Asian market, possibly?
Yeah, absolutely.
Okay.
So we currently are in Canada and the US, and we're looking at some great programs in Europe and Australia, just because on practice management side, we can integrate quickly because they have kind of the same structure. But we're open to work with anyone. The system's there, and if you want to chat, I'm happy to.
Perfect. Thanks so much.